Welcome. Today's episode features women's health specialist, wife, and new mother, Dr. Melissa Hodeib. Melissa was born in Los Angeles, California, to Syrian immigrant parents. Her father ran a liquor store property and her mother a hairdresser. As the first generation in her family to ever graduate college, Melissa received her bachelor's degree in science at Loyola Marymount University and her medical degree from Western University of Health Sciences. She completed her OBGYN residency, subspecialty fellowship in GYN Oncology at UCLA and Cedars-Sinai Medical Center. At only 38, in addition to being a double board-certified GYN oncologist, Melissa specializes across 5 areas of women's health, making her essentially a unicorn in her field. If you're not already impressed, I'll add this. While Melissa could have worked anywhere, she chose to focus and work in helping underserved communities. Enjoy the episode. Welcome in, Melissa. I know you have such a wonderful casual way about you, but I must give you credit where credit's due. You're Dr. Melissa Hodeib.
Yes.
So even though I'm familiar with you, we need to, you did the time in school. Let's give you the credit.
Yeah.
Welcome in today. I'm so glad you could do this.
Thank you so much for having me. I'm so excited about this. I've been so nervous, but also so excited.
You don't seem nervous.
Oh, that's my job.
True.
I'm sort of like an actor in some ways. I have to put on that, straight face no matter what is going to occur coming forward.
Yeah. I actually always forget that doctors have that element where there's so much more to it psychologically outside of the knowledge and the skill. There's this whole other element where you have to deliver difficult news. You have to keep calm and composure in the most. It's there's so many elements to your work.
I know, it's so funny. I often, when I'm in the OR and there's a critical situation happening, in my mind I'm dropping every 4-letter word, and then one thing is cool, I'm like, guys, I'm so sorry for losing my shit. And they're like, what are you talking about? I'm like, wasn't I just cursing and screaming? And they're like, no. I'm like, oh, it was all in my head.
Oh my God.
So, because I've learned, I think my greatest mentor told me, you can't lose control of the room. So as soon as someone senses you've lost control, everyone loses control and confidence. And so you kind of have to put on a good face.
Yeah. So I typically start with give me a little color for your childhood, but I want to give a little broader question. You are such a unicorn in your field, and I want you to explain in your words because I will absolutely botch it. You are you have 5 specialties, you cover so many things. Tell us exactly, and then also that you do the range from surgery to post-care to give us the whole picture.
Okay. Yeah, I love talking about my specialty because I feel it's so rare that people don't even know exists. So I'm a GYN oncologist, which means I'm a women's pelvic surgical oncologist. So I treat vaginal, vulvar, cervical, ovarian, and uterine cancer. And the most amazing thing about my specialty is I do surgery and chemo. And so I get to see patients from the day they're diagnosed and then unfortunately till the day they pass away. And I do all the care for them. So all the chemo counseling, the genetic counseling, if there are, indications for clinical trials, research, then the surgery and the post-care until, end of life care. So I think it's a very unique specialty. We're the only surgical subspecialty that does both. And I just feel not many people know about it. I think most of my family members still think I deliver babies because they're just you're an OBGYN.
Yeah.
I'm like, not really, but
that's what I thought.
Yeah.
Even when you mentioned surgery, I was like, surgery?
Yeah.
And then, you're pretty much almost predominantly, you're doing a ton of surgery.
Oh, yeah. I'm in the OR 2 to 2.5 days a week, and those days are 15 to 17-hour surgery days. So I identify myself as a surgeon.
Right.
But it's funny because most phone calls from the girlfriends I get are when they're pregnant. And I laugh because I'm like, I haven't delivered a baby in 8 years, but sure, I'm happy to weigh in on this.
Right. And so most, what is the difference? A typical OB-GYN, a typical, it's oncology or gynecologist?
So what's cool is you go to med school, you pick your specialty. So OBGYN residency is 4 years. You could be done after that, and then you're just a general practicing OBGYN that does general gynecology care, obstetric care, or you can subspecialize. And there's actually 5, now 6 maybe subspecialties of GYN where you can do oncology, you can do high-risk pregnancies, you can specialize in women bladder issues, you can do something called minimally invasive surgery, or, there's just so many avenues, and then it just requires additional training. So for me, it took 8 years after med school.
My God.
I know. So
After med school.
after med school.
And you're so young.
Yeah.
I mean, we're the same age,
It
so
depends
try
who
to
you ask. It's funny because I don't know if this is TMI, trying to get pregnant again. So when you ask the reproductive endocrinology specialist, and they see you over 35, they're like,
what's the word they use? My OB-GYN said it to me.
Oh, well, it's funny because when I was pregnant, my diagnosis code was supervision of elderly pregnancy.
Oh my God.
So every time I'd come in, I'd be like, can you guys change my diagnosis code? Because elderly pregnancy. I felt like
So
I was
offensive.
like a 70-year-old walking into the clinic pregnant. And, but yeah.
What's the ideal? Why is 30? How old were you when you were first pregnant?
I got pregnant at 37 and then had Gianna when I was 38. And there's this like magical thing. It's actually kind of sad, but women are born with a certain number of eggs, and then they just kind of start to, you lose them, and then and so once you get to 35, not only does the number of eggs you have diminish, but the quality of the eggs goes down.
Right.
And then your likelihood of getting pregnancy successfully decreases. So like all these statistics are just like thrown at you. And so it's like, 35, ticking time bomb, you know, and then it's like 38. Oh, that time is,
Yeah, the window's really
closing. And then, so sometimes it's ignorance is bliss. And so sometimes I couldn't be a normal pregnant person, no one treated me normally. It was insane. I went to visits in between my clinic patients. I worked until I was almost 40 weeks pregnant. I was doing big surgeries. It was insane. Yeah. So.
And it's funny that some people are like, I'm really going to be, I'm just going to be taking it easy and resting. And then you have people doing surgery at 40 weeks. It's like as you're like dilating.
Yeah, exactly.
So let's give some color to your background. Where do you come from? Tell us a little bit about your family. I know you have a very unique story in that you're the first generation of your entire family to do something pretty huge.
Yeah.
After you give some color on your childhood, I want you to tell me why you and your brother, what you think was the magic there that you guys did something so big amongst all these generations where it was pretty unheard of.
Yeah. So my parents are, my dad's one of 6. My mom is one of 8. My mom moved out here when she was 6 years old, and my dad actually kind of fled Syria in his 20s to come marry my mom. At the time, they had to enlist in the army, and he really wanted to come out here and start a life. And so he came to the States and married my mom. I always laugh because he ran a liquor store business for 55 years, and my mom's a hairdresser. And then my brother, who's older than me, is an OBGYN, and then I picked this specialty. And so I always laugh because I'd go to these big interviews and, everyone's boasting about their family history and who donated to what. And they'd be like, what do your parents do? And I'd kind of hesitate for a second because I'm like, gosh, this is is it embarrassing or should I be proud of it? And so when I'd say what my parents did, people would say, what?
Do you think a lot of doctors come from doctor parents or one medical parent?
I think so. It tends to be some sort of generational, uncle, grandfather grew up in it. So people kind of always take a pause and say, wait, how did you become this specialty, or how'd you end up in medicine? And we're a very tight-knit family. And so it kind of was raised by my grandparents. Both were sick as we grew up, and I think being exposed to medical field is all I can remember being a kid is taking my grandparents to their doctor's visits is kind of what inspired that desire to just help people. And it was just a natural, I often joke gosh, why did I go into medicine? It's so hard. But then when I think about it, I don't think there's anything else I could do because I'm always drawn to helping people. No matter what I do, it ends up being some form of I want to fix someone or I want to help someone, and so medicine is just so natural.
I love that.
Yeah.
So I guess that answers the question of why you wanted to really help people, make a difference.
Yeah. And
that's amazing. And do you think you followed in your brother's footsteps, or was this sort of I'm
don't ask me that. Gosh, he's 5 years older. We literally went to the same schooling since kindergarten.
Okay.
We went to the same high school, college, med school. And so when I was going to decide what I was going to do, he had already decided on OBGYN, was in his residency. And I'm like, there's no way in hell I'm doing OBGYN. I want to be a surgeon. That's all I want to do. Then my grandma, who was like my mom, got diagnosed with uterine cancer. And so with cultural sensitivity, it was really hard to talk about like vaginal bleeding and get pelvic exams. So I kind of became her caretaker. And in that process, her surgeon was like, what are you going to do with your life? You know, I was in med school, I was trying to decide, and I said, I want to be a surgeon. And he said, you should do what I do. And I was like, you know, I didn't know about GYN oncology. And then, you know, fast forward 3 years later, my grandma's literally on her deathbed. She wasn't really alert. And one day, the last conversation we had with each other was she says, I had this dream. I got diagnosed with this cancer because I really felt like you need to be the same surgeon like my doctor and provide care for women like me. So please promise me that. And like literally her dying wish. And I was like, all right, that's it. Here we go. 8-year journey.
Was your grandmother's doctor a male or female?
He was a male. Okay. And not the best bedside manner.
Yeah. Yeah. So I'm sure that contributed to it.
Yeah. Yeah. And, you know, she didn't speak English, but obviously she could read body language. And she'd say, like, every time she saw him, she almost felt like, you know, doomsday was coming.
Oh, God.
And I checked him one time and he was like kind of taken back. And his nurse was like, oh my gosh, no one's ever said anything to Dr. Friedman before. I can't believe you said that. And I'm like, well, I think sometimes doctors or, you know, in our specialty, we take for granted what we do and not saying like I'm perfect and I don't forget or anything, but I do the most intimate thing with patients possible. They walk in a door, it's a complete stranger. We talk for 5 minutes. I step out, they get naked, and I do a pelvic exam. In what world does that exist?
Yeah. You saw my meme yesterday.
Yes. But it's true, you know? Like, in what world do you just like, hi, nice to meet you. Okay, I'm going to take my clothes off. Now you can examine me, you know? And so I always try to have a respect of like, this is so personal and this is so intimate. And I am so lucky to be on this side of the table to care for you.
Yeah.
And so my approach to every patient is like, I really treat you like I treat my grandma. And patients at first don't know it. And then after say like, I really feel like family here. And that's kind of been like my passion and my goal and my care.
That's incredible.
Yeah. So
did your grandmother raise you because of that typical immigrant story where your parents were working their asses off and they couldn't? Like, so it's the grandparents end up becoming the parents and the parents are working themselves to the bone.
Exactly. That's exactly what it is. My dad's goal is like once he got on his feet, I mean, he literally came here, I think, with like $3 in his like little suitcase as he tells the story. He wanted to bring all his family over. So he slowly started to he brought my grandparents and then most of his siblings. And we all lived in this one, like, I think 1,100 square foot home. I think at some point there was like 8 of us living in it with one bathroom.
That's intense.
Yeah. So my grandparents raised us, like you said, as my parents were, you know, earning a living. And I'm so grateful for it now because I think it's where I get my passion and drive to do what I do.
Yeah. There's something beautiful about that. And I think that's in many regards, I think where America falls short than many other countries. In many other countries, it's completely societally, almost it's normal and expected that the parents work and the grandparents watch children. Here, it's daycare or babysitters.
Right.
Very different culturally.
Right.
But there's a beautiful thing about leaving it to family members, especially older family members, to take on that role.
I agree. And I feel like it instills like just like your culture and just like it's just different. And I remember when I had Gianna, I was so stressed about like what was I going to do because I couldn't possibly picture, you know, the daycare at 6 weeks, which so many of my friends had to do because of how different it was for me. And I got blessed in the sense that my aunt actually is my nanny and takes care of Gianna. So it's like that same vibe. And it's my grandmother who passed away's daughter. I almost feel like she's like weirdly living through my aunt and raising my daughter. And I love it. You know, like she teaches her the language and the culture. And it's just so beautiful to see that that is still being carried on.
That's beautiful. That's very lucky too. So you fulfilled your grandmother's wish. Yeah. We did all the things. Grandma's looking down. It's interesting. You mentioned just briefly how there's a cultural sort of shame around talking about lady parts.
Yeah.
Very similarly in my culture, the Jewish culture.
Yeah.
Are you Syrian, Iranian? Are you both?
We're Syrian Orthodox.
Okay.
So yeah, Syrian, both sides.
Okay, Syrian.
Yeah.
Very similarly with the Jewish community, sexual health,
Yeah.
women's, private parts.
Yeah.
It's interesting. It's like a real thing. So I guess is what happens, people feel they don't want to speak up about what's happening, changes, like what's happening there?
Yeah, I think, and that was another thing that sort of drove me to do what I did, because I felt like it was unique in that I was a woman in this culture that had this, like, oh my gosh, you can't say the word vagina. You can't say the word sex. You can, so like my grandma was having vaginal bleeding for 3 years
Oh my God.
and never told anybody because she was so ashamed. She felt like she was doing something wrong. My grandfather had been dead for many years. It's like, why am I having this? She felt embarrassed. And I just felt like I never really thought about that exists amongst so many cultures, that fear of saying the word vagina. So I kind of try to normalize it, you know. My mom laughs, my husband laughs. I'm just very open about it. And I'm just like, we got to talk about it more. Like even at our church, I often am saying like, hey, anyone want like a sexual health course? And like, I think people kind of like,
Yeah, I still can't even really say it.
Right.
In my intro, I wanted to like talk about your 5 like subspecialties, and I was like, can I say these 5 words in my intro? Can I say? And then I thought to myself, why the hell would I not be able to name the parts that exist within my body?
Right.
Even I don't think today, at 38-year-old woman, I don't think I could just say all those things. It's such a real phenomenon.
I know. And it's like we have to do away with it because it's like then you normalize people being able to complain about having abnormal discharge, abnormal whatever, bumps, lumps. I always say like breast cancer gets all the love, all the pink, all the races, but like your vulva needs love too.
Yeah.
If I can
Ain't
say
that the truth, ladies?
In many ways, right? So like people don't know you should do skin checks on your vulva. Just like people are taught to do breast exams, like you shouldn't have discolorations in your vulva. And you know what's funny? I'm saying vulva. I feel like so many people don't even know what your vulva is.
I gotta admit, I think I'm one of those people.
It's okay to admit it. So vagina is really just the inside.
Right.
The vulva is all the external stuff. And so you can develop cancers externally along the vulva. You can develop cancers inside the vagina. And like people may have discoloration, itching, burning, and just think this is just what vaginas do. Yeah. This is what vulvas do. But no, like, you got to educate people. You have to do skin checks. If something is discolored or new, like you have to demand a biopsy because that's how cancers get picked up.
Do you think that contributed to your grandmother's death, just the 3 years where she didn't speak up?
Yeah. Because when she was diagnosed, she got diagnosed at an advanced stage 3 cancer. It had already spread to her lymph nodes. And the one good thing about uterine cancer, there's not great things about cancer, is it does present with a symptom, which is abnormal bleeding.
Okay.
If you're menopausal, you should never have vaginal bleeding ever, ever, ever. Okay. So if you have it, that's a sign. And if you're premenopausal and have abnormal periods, they're heavy, you bleed in between periods after sex, that's also a red flag. And so had she said something 3 years prior, maybe we would have caught it at an early stage. Who knows?
Right. It's hard to say. But I mean, as a doctor, there's probably every fiber of your being wants to be like 100%. I could have helped her had I known sooner.
Yeah, exactly.
It's like, I guess I always think to myself when I ask any question, what's the antidote for this? The antidote is talking about it, even if it's uncomfortable, even if your community is not comfortable with it. It starts with us, like you having that personal agency, talking about it with your friends. And I mean, I guess it's a weird thing to start comparing your parts to your friends.
Well, I will tell you, my text messages are colored with all sorts of things. I get photos, I get texts, I get photos of texts from friends who don't know me, who know I'm so-and-so's friend.
The FBI must love your text.
Oh, yeah, I know. I always laugh. I'm like, if they're listening and watching, they'll love my content. But I always joke that people don't go to the gynecologist when things look good or
it's
pretty.
So true. No.
So all the, glorious images people think I get, I don't get that many of them. But yeah, I think it's funny. I've even had women in our community who just know what I do and have randomly reached out to me like, can I trust you at this in privacy. And I am a very much like HIPAA.
Yeah.
So I know things about so many people that no one would ever have any idea I know.
Yeah.
But it's because people feel that comfort, and I want to make sure they have it, and I'm sure our community, like everyone else, gossip happens, and
Oh, yeah.
they're always so fearful, like, gosh, is she going to say something? And then if it ends up coming out later, and I'm like, gosh, you never told anyone. I'm like, of course I didn't tell anyone. This is your health, so if
Could you
anyone
imagine going to the doctor?
Yeah.
and worrying that your doctor, the person who's taking care of your health, is going to tell what your church, your community, what, at a dinner party? I mean,
Exactly.
It's wild.
Yeah. So, I mean, maybe if any of your listeners have personal, maybe we'll touch someone's life and they'll reach out too.
Yeah. My God, I hope people do.
I hope they do.
I want to talk about that importance of bedside manner and just because I know, so I'm a self-proclaimed never nude. This was a concept I heard on the show Arrested Development. It was his character Tobias, and he never got undressed. It's a real thing, and never nude. And it's for years, the thought of going to doctors was crippling for me. I mean, crippling.
Okay.
Not even because of a bad diagnosis. Some people don't like to go to the doctor because they're hypochondriacs or afraid of a bad diagnosis.
Right.
I was never worried about my health. I did not want to get undressed in front of somebody I didn't know.
Right.
I never suffered like sexual trauma or anything like that. So for some people, it's very legitimate. Mine was completely irrational.
Right.
But
But it makes sense. It's literally a complete stranger.
Yeah, it's against everything your body wants to do.
Exactly.
Meet stranger, strip off.
Yeah. I mean, you don't even want to do that with someone you've been on a few dates with.
No.
Let alone someone you walked in that said, knock, knock, hi, I'm Dr. Hodeib. Can you take your clothes off?
Yeah.
Yeah.
But it's just often now I feel if anyone listening who's gone to a doctor in recent years knows, a lot of us are just treated like numbers. You're in, you're out, boom, boom, boom. Everyone's got to just see an X amount of patients a day.
Right.
It starts to feel kind of clinical. And like, is there any, can patients advocate for themselves? Is there anything people could say or do to help make the environment better? Or it's something to, like, as a doctor, is there something we could do to sort of maybe say to, I feel really anxious when I'm under, like, I don't know. What do you do?
Well, for me, like what my practice is I let the patients stay dressed so that I don't walk in and they're already, half
In a gown.
undressed. Yeah, in a gown. Because I think that's so like impersonal, So I come in and I always set the tone. I say, hey, I know being here sucks. I have the oncology title. I know you're already nervous, but I want to just get to know you. I want to talk about your history. I want to talk to you about what I have in this computer. And then when you're ready, you get undressed, I'll step out, we'll do an exam. I always allow my patients to have at least a family member there if they want. If not, I'm like, you can FaceTime a daughter, a friend, or whatever, because I want them to have that sort of sense of like comfort. They're not alone. And sometimes patients are like, no, I know your exam's important, but I don't feel comfortable. And I'm never like rolling my eyes like, are you okay? I get
you
it.
can opt out of it, but then how do you get the help?
You can,
Yeah.
but it's like for certain things,
You need to.
you have to, you don't have to, but you need to, it helps in your diagnosis. You may have to do a biopsy. Someone can't come in for a vaginal lesion and then I can't see it.
Exactly. Do you have to have a nurse with you, or is that just a male? So every doctor, regardless male or female or the gender of your patient, you have to have somebody else with you.
Yeah, we always have a chaperone.
Right.
And in our clinic, we actually consent patients for the exam so they know what they're getting. My exam is extra special because I do a vaginal and a rectal exam.
Oh, how fun.
So patients are always like, you're going to do what?
Yeah.
And I always tell people like a true gynecology exam is a vaginal rectal exam.
I did not know that.
Yeah, that's how we feel the back of the vagina.
So have I not been getting proper exams, or?
I will tell you, a lot of people avoid the rectal exam just for many reasons.
I was never even offered.
Right. Yeah. But for us, that's kind of how there's some of my pathology I pick up, I find in a rectal exam because things can hide behind the uterus, the top of the vagina. Sometimes patients have masses that are compressing their rectums. I need to know that because the crazy thing is part of my surgery is we do all of our own like bowel surgery and whatever. So sometimes I have to resect portions of patients' colons if a tumor is invading it. So I need to know all that before so I can appropriately counsel a patient like, hey, you might need a colostomy, you might not, you might this. And so it's really helpful. But when I tell patients that, they're like, you're going to stick your finger where?
Yeah. No one's ever. That's so interesting. I actually like feel like now I need to schedule one of
Well,
those.
come on down.
Yeah, you know what? Nothing makes a never nude more excited than the thought of you putting your finger in my bum. I read yesterday, was it the day before, and I'm sure you saw it too. It's like everywhere. They've just recently bumped up the breast cancer screening from 50 to 40.
Yeah.
And I wanted to ask you, it was like, I didn't even plan on this, but now since it's current, is the same thing happening in like the women's health space from like the vaginal perspective? Like, are you bumping up the time for that you want women to get that looked at?
Well, the thing is, what's been unfortunate with COVID, as so many things have been unfortunate, is those years where women were going in for screening, pap smears, this, that, and another.
Yeah.
No one was coming to the hospital. And so now I literally every day my inbox is exploding with 5 to 10 new referrals of cancers in young women.
Oh, no.
And the people that are presenting all at an advanced stage. And I 100% believe it's because people weren't being screened. So for us, we haven't changed guideline timing, but we're really harping on like, you have to get in for your pap smears, you know, your colonoscopies, your screens, your mammograms, because so much I think was being missed during that phase for, you know, obvious reasons. But it's just been unfortunate because we've seen just an implosion of cancer cases since COVID.
I never even thought about the fact that so many people missed, 2 years?
Oh, yeah. It was like
Easily. Because we have to assume that people were not staying regular even before COVID, as you know.
Right.
What would you say the percentage of people that stay on top of their annual PAPs?
Maybe 40%.
Oh my God.
Yeah.
That's a
maybe.
low number.
It's a low number. I mean, think of the HPV vaccine, and please,
I was going to ask that.
vaccine haters don't come at me, but we have a vaccine that prevents a cancer that kills people.
Yeah.
And people don't get it.
I know.
We're in the United States and our vaccine rates are like 30%. You can go to Rwanda in Africa where they have like the per capita rate, you know, is like nothing compared to the US, and they have 100% vaccine rates.
Yeah.
And it comes from education and from people's like trust and willingness. But here it blows my mind how hard it is for me to get parents or patients to get vaccinated against HPV.
I actually want to talk to you about that because my son has it. My 18-year-old son. We got it. It was offered to us when he was 16 or 17.
Yeah.
I said absolutely.
Right.
And here's why I said absolutely. So I never skip a pap.
Yeah.
I went in. We did an annual. She was like, "Oh, we found some stuff. Don't panic. We're going to come back. We're going to do the thing."
Yeah.
Came back again. I ended up needing to subcise 6 quadrants of my cervix.
Yeah.
That were very late stages. She said, had I missed that exam that year and gone a whole other year or more for some people, she's like, you would have been looking at a very different outcome than just being able to
just remove a portion.
Remove it.
Yeah.
Portion of my cervix. So and that terrified me. That put the fear of God. Now I never miss, and I'm very vocal on my Instagram. I'm sure you see about ladies don't skip a year.
Yes.
But when I thought to myself, if through my son I could prevent, God forbid, a woman contracting something like this, and it doesn't have to be. I think a big stigma, especially in our communities, is, oh, you have HPV. You must have been loosey-goosey. You could get HPV from the very one and only.
It could be your partner you marry and be with for the rest of your life,
right?
As long as they had been active before you, right? And that's what drives me crazy.
So
too,
wait, the person would have to. It couldn't. I just thought men were carriers, no? Or
no, so it's a sexually transmitted virus.
Okay.
But you can pick it up from just one partner.
Okay.
One of the partners have had to have been sexually active. So if you were a virgin, you thought you married a virgin, and one of you got HPV,
start asking
some questions. Either you're lying or keep it to yourself, or the partner's lying.
Right.
Because that's the only way it can come from.
But that's why the HPV has so much shame around it, and people don't want to get that vaccine. It's like, well, if there's no way my child, but we don't know.
That's what drives me crazy is parents say, like, because we offer it now. You can offer it as young as 9, and the best time to get it is before any sexual activity. The newest virus, the newest vaccine protects against 9 strains of the virus. HPV has multiple strains. strains, some cause cancer, some cause warts, some, don't have the association. But the newest vaccine covers against 9 of the highest risk. And they actually just bumped up the age. So it used to be like in your 20s, it was cut off. Now it's mid 40s.
Okay.
And I even tell patients, even if you have a history of HPV, you're been with the same partner for whatever, I don't care, get the vaccine.
Yeah.
Because you never know. Your partner may die, your partner may cheat on you, who knows?
Right. Yeah, life's unpredictable.
Just protect yourself.
So what, I mean, well, I'm just going to, I'm pro doing all the preventative stuff.
Yeah.
I think a lot of mothers fear giving their daughter specifically the HPV shot. What are some of the concerns around it, and can you add any comfort or knowledge on that?
I mean, I think number one, anything related to sex freaks parents out,
Yes.
especially their girls. It's like birth control.
Yeah.
If I give my daughter this, it's going to promote them to have sex.
Right.
And I hate to say this, they're all going to have sex anyways. I know.
At
I don't
some
want to hear
stage.
that. Yeah.
La, 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 la.
La, 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 right? You have a young daughter. My daughter's 1. I don't even want to think about it.
Yeah.
But it's like, we know it's going to happen.
Yeah.
We were all, kids. We know how this goes. So why not do the best thing you can to protect them? But for some reason, there's this stigma that a sex-related treatment, birth control pills or vaccines is just going to promote that your kid now is going to think, well, I'm on birth control, so I can have sex, or I got my vaccine, it's fine. And I think I see that. And then, there's the big culture of the anti-vax and what goes into the vaccines and what makes them. But again, I don't mean to be a bearer of bad news, but people that I see that have cervix cancers aren't uninsured 80-plus-year-old patients. They are 25, 26, 30-year-old mothers of young children.
That was me.
1-year-old, 2-year-old. I've had to tell a mom she's dying from her cervix cancer while her 3-year-old is crying in the room, mommy, pick me up. Probably one of the worst days of my life, because mommy, I knew wasn't going to be around 6 to 8 months from that visit day. And I look at it and say, we have a vaccine that could have prevented this. And I get angry because this happens every day for me in my clinic, and not to say if you're over a certain age, it's okay to pass, but my gosh, telling a 30-year-old she's going to pass and has 3 young kids who will never see their mom, it's horrible. And those are the patients we see. And now after the COVID insurgence, I mean, I'm telling you, my cervix numbers are through the roof. Whereas for a while, it was kind of dying out from the PAP and from the vaccine. And there's right now, like the World Health Organization has this goal to eradicate cervical cancer. And I hope that happens. I just feel like I don't know, with the vaccine fears we have. I think COVID made it worse.
Of course.
There's so much politics behind it. I wish I could take all that out.
I know. So you really believe that if really everyone or nearly everyone young person got the HPV shot, we could virtually pretty significantly eradicate cervical cancer.
Yeah. I mean, there are rare types that are non-HPV related, but most, are. And so we
That's
could
compelling.
So we could really get to a point where those numbers are so small. I pray that happens. I tell all my patients, I wish someone would put me out of a job, meaning I wish we could find the cure for X, Y, and Z. Because people always tell me like, oh, you're the doctor, I'm sure you have the cure saved for yourself. I'm like, no.
People say that?
Oh, yeah. People think I have like the secret stash of like the ovary cancer lifesaver.
Let me go to this little tincture right here.
Yeah.
Break it in case of emergency.
I know it's because I'm, don't have this insurance you're not giving me. And I'm like, no, I promise you, if you could put me out of a job, I would be happy, because what I see and do every day is really, really hard. I mean, I'm literally having to tell people that they're passing away every day. And that doesn't come lightly. No matter how many times you do it, telling someone they're going to pass away in a room with that person's daughter, son, husband, it's not easy. It's gut-wrenching. So.
How do you even prepare yourself psychologically to do that all the time? What kind of toll does that take on you as a human being?
I'll tell you, there's it's not silly actually, but there's this term we have called compassion fatigue. I think it's not talked about enough, but it's the fatigue oncologists deal with from constantly giving bad news. Because like, even though and sometimes, and I hate it, and I've always checked myself to say, don't ever be jaded, right? Don't ever think that, okay, it's just another person, check off the list. It's never the case, right? Because for me, again, my specialty being so rare, I see these patients every 3 weeks. They do become like family. You walk in, I know your daughter's name, I know your dog's name, I know what you did last summer, And so looking at this person and saying, this is it. It's honestly the worst. I'm very much not egocentric, as you know, like me saying Melissa, not doctor. People ask me what my profession is. I say I'm in medicine. My husband rolls his eyes. He's like, just tell people what you do.
Yeah.
But I cry with my patients.
Yeah.
Because I think you have to show a human compassion to allow people to understand that you feel for them. And I feel like a lot of that is lost in medicine because we're so worried about billable minutes and I have to close my charts. I have 50 people waiting for me. There's all these stressors. But you're telling someone they're about to die. Doing that in 3 minutes? Oh. Yeah. Oh. And so I often say, this is your time. We're going to talk. We're going to cry. There's 10 people waiting for me out there. That's okay. Because I will walk in and let them know now is your time. And so I'm always behind.
Of course.
But that's okay, because you that person in that room deserves those moments.
Man alive.
Yeah. It's tough. It's tough. And I think this takes us back to, you asked me about bedside manner. And I think when my grandma surgeon kind of relayed news to her, it wasn't done in a compassionate way. And even me being like, I wasn't the patient. I was in med school. I kind of understood. I was so emotional, yet alone. And I was trying to be strong for my grandma. And I knew she knew what dead and dying meant, even though she didn't speak English. And so I've just learned you have to relay things in a way that you show compassion. And she always said to me, I'd always laugh. She'd say, have the strength of a man and the beauty of a woman. And I really feel like I practice that. I try to be presentable to my patients and strong for them, but in the same way, compassionate and know, like, I'm going to cry with you. It's okay. It doesn't make me weak.
Yeah.
It makes me human.
Yeah. Empathetic.
Yeah.
Going through something really life-changing with them.
Yeah.
And you specifically have this whole other component where you're with them from beginning to end, whereas a lot of doctors are passing stuff off to the next specialist or...
Right. Yeah.
Wow. I'm trying to...
I know. Sorry.
No.
Bring darkness to
it's not darkness. It's truth, and it has to be spoken about, right? If we don't speak about it, we can't create change. And and we're trying to create change, right? It's like why we're doing. That's why you're doing this. That's why I'm doing this. Right. That's why this subject was so important to me.
Right.
I personally experienced it.
Yeah.
I was lucky enough to have a female doctor. I'm not saying that male doctors are not compassionate. They are. But we do often see a difference between male and female doctors, and we have to talk about that.
Yeah.
Firstly, in your med school, what percentage was female versus male?
Well, it's funny because when I went to med school, gosh, feels like 50 years ago.
Probably wasn't because you're so young. But so experienced.
It was so experienced. It was, I would say at the time I went probably like 70-30 male to female ratio.
Wow.
Now, interestingly, it's like 50-50 and almost tipping over 50 to the female, like more like 55 women to 45 male.
Yeah.
And especially in the surgical subspecialties, I mean, you used to walk into an OR or a surgeon's lounge, it was all men.
Yeah.
As a woman, you kind of stand out. Now it's like all women. I love it. I laugh and joke. My specialty was mainly only men. I mean, there's like the few, we call them the queens of GYN Oncology, that like broke the system, when they did. And I'm so grateful for them. I was lucky enough to have one as my mentor. But it's such a unique dynamic for me because even though I'm in a women's health specialty, the women in my specialty were often the hardest for me, the meanest to me, the talk down to me. People don't realize this in medicine. It's such a like mean culture in your training. You are like a speak when spoken to. You kind of get treated like shit.
What?
Yeah.
I mean, I guess you see it on the TV shows. You see it on the TV shows, so you're kind of expecting it, but I'm surprised to hear that that's real.
Oh my God, it
I
is
guess
real.
art imitates life, right?
Yeah, and especially in the surgical,
Right.
It's like it's tough. It's
Right.
basically like you got to go through this like rigorous training, and you got to jump through your hoops and put in your time. You put your head down, you say thank you, yes sir, yes ma'am. You know, you're often told how much you suck, how no. I'll tell you, before I interviewed for my subspecialty training, my mentor, who was this beautiful woman who, whatever I looked up to, she looked at my application. You have to submit a picture. And she said, Hodeib, do you think this is Grey's Anatomy? And I was like, what? She's like, you have makeup on, your hair's done. Real surgeons don't wear makeup, and real women surgeons don't shave their legs. No one will ever take you seriously, and you will never become a GYN oncologist. And closed my file and handed it to me. And I was just like mortified. So I'm like battling this, like, this is who I am. You take me as I am, a kind of attitude. And like I told you, I had this upbringing from my grandma who was like, always present yourself well. Patients will know that you care enough to take care of yourself. That means you care to take care of them. And then I have this other aspect of like my mentor saying, you're a joke because you have mascara on. And I'm like, why is this what I'm dealing with when all I want to do is help women?
And from another woman.
And from another woman, right? I'm just thinking like, and we're in a women's health specialty. We should be the utmost feminist, right? But I can't tell you the comments that I've gotten, I just, and you just bow your head and take it, and you put in stride and go. But it's just so unfortunate that even today, that's what you deal with. You know, I remember my first day walking into work at my current job, and they said, oh, here's the princessa. I'm like, okay, sure. You can call me princess.
Yeah, okay.
I was like, yep,
Oh my goodness.
But yeah,
I guess it shouldn't surprise me, but of course it always does.
Yes.
That the hardest thing that women come up against is other women.
Yes.
It's been a recurring theme this season. It upsets me so much to have to admit that. But now you're reaffirming.
Yeah. And like, I feel like I go out of my way. My husband always laughs at me. Like if I'm at the gym or something and I see a beautiful woman, I will go out of my way to go up to her and be like, you are beautiful.
Yeah.
You're stunning. Your body's amazing. And people kind of like look at me like, what? You're talking to me?
Yeah.
I'm like, yeah, and especially the younger generation, I go out of my way because I'm like, you are beautiful.
Yep.
Forget what Instagram tells you. Forget what this girl says to you, because I'm like, we need to empower each other,
100%.
I'm like the biggest supporter of my girlfriends. My friends calls me with a success story. I want to blast it, but
I think that's a family thing because, you're Kaylin,
yes,
your cousin, my dear friend, also so empowering to other women. She's always complimentary and kind, and so it must be a family thing.
Yeah,
but you're right. It's just women are we're often the last ones to tell each other we're beautiful. The last ones to say you're doing an amazing job.
Yes.
I'm proud of you.
Yes. And it's like, I think I told you this when we were chatting, is like when I'm in the OR, I tend to be pretty laid back. You see me, I'm cool, I'm chill, I'm serious and like focused and professional, but I never want to be like I'm the doctor, you're the nurse, like mentality. I hate that. I'm like, I know the people who take out the trash in my OR's names. We chit chat in the hallway. Everyone to me is equal playing field. But when shit hits the fan in the OR, you got to take it up a notch and you got to make sure everyone's listening. So if I do have a critical situation, I speak up or I'm loud or, raise my voice, people will say like, oh, Hodeib, you on your period today? And I'm like, what?
You're rocking me to my core. I cannot believe this is happening today in 2023.
Yes, in a OR. But my partner, who is a very loud, dominant male Persian man, when he yells, people shiver. Everyone's quiet. The music goes down. It's like, yes, what can we do? What do you need? And it's never spoken of again. But like my situations, I'll go and someone will write a complaint about me. And I'm like, wait, what? I was literally asking for blood and no one was listening and I had to raise my voice,
What is that about?
I don't know. I feel like it exists in so many elements where like we're constantly having to battling like who we really are, and like almost I've heard it before from women where you almost have to like play the level out the playing field. Like I've had friends that are female surgeons who almost make themselves more masculine to like fit in with the boys.
Yep.
And I'm like, no, because I'm not doing that.
That's not who you are.
It's not who I am. I love sports. I can talk about basketball. I can shoot the shit about football. But you know what? I can also breastfeed my daughter and talk about it in the OR and talk about my milk leaking out. And you guys are going to have to accept that.
Yeah.
Because that's just who I am. I'm not going to be afraid to talk to you about that stuff because it's a boys club. You know?
I saw that. I posted the other day. There was like that cartoon. What's the difference between assertive and aggressive? And the woman responds, your gender.
Yes.
Assertive and aggressive.
That's so
What
perfect.
is that? That is exactly the scenario you just painted.
It is exactly.
So do you push back when that happens? When someone's like a Hodeib on your period? Firstly, I mean, the last name, I guess, is what is that OR talk? I mean,
yes, we only refer. It's like sports.
Okay,
everyone only refers to you as your last name. Yeah,
but you push back.
Yeah, I do. I say, guys, listen, I am friendly. We are buddies. But at the end of the day, my only job, I tell this to everyone, is to that woman on that table. She is asleep. She is trusting that every ounce of any ability I have to give her is 100% focused on her.
Yeah.
And nothing will take away from that. So as much as I'm lighthearted, whatever, nothing to me is more serious than that patient in that case. And so if it means me speaking up, and I always tell people, and then that's when I check them, if that was your mom on the table, how would you want me to react in the same situation? Would you want me to raise my voice, or would you want me to, don't worry about it, guys.
Yeah.
Take your time getting that instrument I need.
Yeah.
And everyone's like, no, I get it. I'm like, no, do you get it? Because this is someone's mom, someone's grandma, someone's daughter. And again, the whole family in the lobby thinks my 100% focus is on her. And if we lose that, then why are we here?
Yeah.
And then people kind of like feel bad, but it shouldn't
be
take
that. It should not take that. I want to talk a little bit about you have aggressive hours. You are working these long days, and you're a new mom.
Yeah.
You're still breastfeeding.
Yeah.
Pumping at work.
It's crazy.
Well, what's that? And by the way, and soon maybe even another one. So I mean, what's that like? And that's it. That's an intense existence.
I think everything about me is intense.
Yeah. I'm figuring that out.
Yeah, right. If you talk to any of the girls that like trained with me, my residents, my interns, they always joke. They're like, "Hodeib, you're so intense." Because I'd always joke. I'd say like, "Make sure you always carry a scalpel in your pocket." And like the younger generation would be like, "Why? What's gonna happen? Why do I need a scalpel?" I'm like, "You just never know." And so like,
in case someone asks if you're on your period.
Exactly. And so I guess that's kind of my motto. So like when I got pregnant, everything about me was intense as usual. I like planned every aspect of it, right? I was like, I'm going to get induced on this day. I'm going to soul cycle 12 hours before my induction. I'm going to operate till it. So when I had her, I was like, I hope I produce milk. I hope I can breastfeed, because it's just been the most beautiful bond for me ever with her, because it's the one time I'm allowed to not be intense. I completely zone out. I can put my phone down. No one can bother me. It's just Gianna and me. And so going back to work, I would say I was so stressed. Like, am I going to be able to keep it up? I do these crazy long surgeries, long hours. And so I bought these hilarious pumps that you put your bra.
Yeah.
And they're cordless and they have a timer. And so I put them in. It looks like I have implants in.
Yeah.
And I'm just doing my case, and every 2 hours they just and my partner's like, "Are you pumping?" I'm like,
"Will you
yeah.
pump during surgery?"
Oh yeah.
Oh my God.
Because otherwise you get engorged.
Exactly.
Or your supply
You got
goes
to.
down. Yeah.
And men will never understand this.
Never.
And men could never.
Yeah.
Could you imagine a man operating on a patient while pumping
milking
for their
prostate
baby at home?
No.
Not gonna. I mean,
No. I mean, and it's every 2 hours, right? So in the beginning, to keep your supply up, it was every 2 hours. So even in the clinic, I'd be like seeing a clinic patient. I'd run out, put my pumps in, go see him, So I'd be having a full on consult with a patient and my pumps are going off. And my only stress was like, I really hope they can't hear this pump. So I talk really loud. But then there was a little light and like,
there's always like a,
yeah. And so my patients, so I just started telling people like, hey, I'm sorry, I'm pumping. So elephant in the room, like if you hear something, just ignore it.
I guess they're all, your patients are female.
Yeah.
I was thinking to myself like, oh, is that awkward? And then I realized it's less awkward that you're dealing with female patients.
Yeah.
I'd be remiss if I didn't just say that I think it's so admirable that you are unwavering in your dedication to your daughter and showing up for her as a mom, while at the same time being such a just badass at work. I mean, those are very difficult things to juggle.
Yeah, it's thank you for saying that, because it's like no one really says it, and you feel it and you think it, but I'm like, I always feel like my life is on a rush. I commute an hour to work because I'm very passionate about an underserved patient population. And so I trained in LA and I felt like everyone in LA, you could turn your head and it's like a nail salon. There's a doctor's office, and for even my specialty being as rare as it is between like UCLA and Cedars-Sinai, there was like 14 of us. So where I work, I actually work in Riverside. People will think I'm crazy because I commute an hour each way to work on top of having the daughter and working crazy hours.
Yeah, that's insane.
But I serve a really amazing patient population. Where I am, there was only one GYN oncologist who covered the entire Inland Empire. So now there's only two of us, which is still insane. But it just even adds more passion to my work because I feel like I serve a group of women who really need help. And so some days I think my 24-hour days have to have 36 hours in them because I'm not really sure how I'm juggling everything. And I hope I touch someone's life that's out there feeling the same way, because it's crazy. I mean, sometimes I'm like pumping on a patient phone call, doing the dishes, trying to feed Gian. It's like, I have 8 hands.
Yeah. Well, one of the things that I was passionate about in highlighting and showcasing this season was women that are doing very big and in many regards masculine things out in the world while not compromising their femininity. And what for me is standing out is that I'm sure there was an expectation and almost an unspoken thing where people would have just wished that either Hodeib, take the time and stay home with your baby and come back when you're ready, or bottle feed.
Yes.
And you were like, absolutely not.
Yeah.
The same dedication I give to my trade, I'm not compromising on my family, which is very hard for women to do these days because the society is not supporting that choice.
It doesn't support it. And it almost makes you feel like you're like you're shameful for it.
Right.
You know what I mean? But I'm like, it's like I joke when like my partner said, you're pumping it OR. I'm like, yeah, my daughter's got to eat, Yeah. So as much as I give 110% to this patient on the table, she at home wants 150%.
Yeah.
Not 110.
Right. And why should one have to be compromised?
Right.
And I mean, the argument would be, if it were me and maybe I'm selfish, I'd be like, my daughter would get, my priority would be my daughter. But I guess you have such a, you're a servant to the people.
Yeah. Yeah. I mean, I feel like I waited so long to have Gianna because I wanted to never sacrifice what I learned as a trainee. I have so many friends who did it in training, residency, specialty fellowship training, and they go back to work, imagine 6 weeks postpartum. And now having a baby, I can't even imagine at 6 weeks. I mean, your vagina is still in pieces after you have a vaginal delivery or a C-section. You're 6 weeks. I mean, what is 6 weeks? You don't blink your eye at 6 weeks.
It's crazy.
Yeah, but so many of my friends, because as a trainee, you don't get that luxury.
You don't get that.
I was like, I waited, and now I'm paying the price because I'm the elderly pregnancy. But I felt like I could finish my training, do that focus, and now shift my focus to being more, of that mom. Yeah. But still trying to do both. It is a struggle, and it's not one I feel like I ever do well, because I feel like everyone, I'm shortchanging everyone all the time. When I'm at work, I'm like, my gosh, I'm missing out on Gianna's first word, her first step, when I'm at home, I'm like, gosh, I should be doing research. It's my mind is just constantly pulling me in every direction. I need to be a better wife. I need to cook more. I need to do more laundry. And this is where my mind is 24/7. And again, I feel like a man just doesn't understand that.
No. My sister just told me her manager just left on maternity leave very recently, delivered a baby, she had an emergency C-section and also needed an emergency hysterectomy.
Oh, gosh.
Okay, so emergency C-section, emergency hysterectomy, and her baby was premature.
And don't tell me she came back to work like 4 weeks later or something crazy.
6 weeks later, and with the same demands, and nobody has acknowledged. And my sister said she's being quite hard on herself, like, oh, I should have remembered that, or I'm dropping the ball. And it makes me emotional to talk about this and just hearing, because it's like, what's it gonna take?
Yes. What's it gonna take?
Because this, how are people expected to do all this? How are we expected to do all this?
I know. I mean, there are times on my drive to work or from work, I just burst into tears because I'm like, I say like this like little prayer mantra, and I'm just like, just give me the strength, because I don't know sometimes. I mean, like my struggles are, Gianna's never slept since she was born, and I am so sleep deprived. It's like not even funny because she just doesn't sleep. And so I think I've most gotten spurts of like 90 to 2 hour sleep increments. So between no sleep, the commuting, the strains of the job, trying to be a wife, a daughter, a mom, I'm like, something's going to break. Something's got to give. I had the luxury of, I took 4 months off. I still didn't feel ready at 4 months, and our society just doesn't understand. People were like, my partner would say like, you were just off for 4 months. I'm like, off? You think it was a vacation? I'm like, between your body healing, your
don't you
hormones,
love that?
Yes,
you were off.
Like
birthing a human, bringing them to the world and taking care of them is having time off.
You pushed a human out of your body, C-section or vagina, and that's being off. Your hormones have just done a freaking complete spiral. You're maybe going through postpartum depression, you're sleep deprived, maybe finances because you're not working. I mean, all the strains.
Some people are struggling with breastfeeding.
Yes.
Your relationship, your marriage takes a toll.
Totally. And I laugh because like I had to meet with HR before like deciding how much time I want off. And I was like, this is the most confusing process ever. And basically you're telling me I can choose to come back at 6 weeks, or if being at home is more important, I could be unpaid for 3 months, and I'm like, how do we do this to women? I swear I don't know how single moms do it. I give all the praise and all the love because I don't know how it's possible.
I don't think any single mom's doing what you're doing.
Yeah, but
it would
still,
be impossible.
I mean, it's just like just caring for a human is so hard.
Yeah.
Let alone juggling life.
Yeah. I mean, I have a personal theory that every mother is essentially a single mother.
Yes.
Because let's be honest.
Yes.
Right?
I say
we're doing a lot of the heavy lifting.
Yes. Yes.
Unless you have a super hands-on dad, which is like 25%.
Right.
Most of us are single moms, even if we're married.
Right.
Even just from an emotional standpoint. But all right. So I have so many things that I want to talk to you about. And I'm like, okay. Talk a little bit about navigating. I heard a stat once. Yeah. I don't know if it's true. It feels like it could be. Surgeons have the highest rate of divorce from any other profession, because the reason was because in your training, you're taught to completely listen to yourself, block out everything. You make judgment calls. You're in control. Everybody, blinders, right? Yeah. How does that translate in the home?
Oh my gosh. If Jeff listens to this, he will just roll his eyes. But it is so hard. I find that is my hardest job, because he always says to me, there can't be two lions in this jungle. And I'm like, yes, it is only me. Exactly. It is so hard because, at work, if I say something, people listen because I'm the boss.
Yeah.
And I get to call the shots. And so I think any marriage struggles we've had have been from my lack of an ability to dissociate that power control. It's hard. It's really hard. And so especially if you have a strong-minded like partner, which he is, I feel like we butt heads a lot about it. And some of the, roles that society has put on of making meals, for example, which he's really good at, that he wants me to take on, I just have to say, like, we're partnership. Something has to give. So I've learned to talk back less. I've learned to pick my battles.
Yeah.
And that I can't always be right. And in some ways, just making the other person feel like they do have some control. Their word matters. But it's so hard. And having a new baby, I think definitely threw a wrench into all of that, because that and sleep deprivation. I mean, there were times where I'm like, I just can't do this anymore.
Yeah.
And I said it more times than I wanted to. And I was so scared. Like, am I the only person who's gone through this? And then I talked to so many friends who were like, oh no, I thought I was going to divorce my husband 50 times after we had the baby.
Oh, yeah. Because if you forget all the work elements, just having a child within a marriage shakes up everything.
Right.
Your priorities shift in a lot of ways.
Totally.
Then you have this whole other added element.
Yeah.
So it's a lot of...
Yes, it's a lot of like, I talk to myself a lot. I found myself in the beginning being very resentful of him because he had a flexible job.
Yeah.
Mornings he could stay in bed with her while I had to get up to go to work, and I hated him for it. And I found myself like reacting, not telling him why. He had no idea, but I was so hateful towards him because I'm like, you can be home with her in the morning when she wakes up. You can come home from work if you want early. And he had to remind me. At some point I said it, and he was like, but this is the life you chose.
Yeah.
And this is the life I chose, and it's not my fault. And so I've had to check myself, when I'm tired and I get home from the OR and it's my time to put her to bed, and he's watching the Laker game, and I'm like, you mother effer, you have no idea how tired. And I just like take a deep breath and say, like, it's okay. This is not his fault.
Right.
But it was hard to separate those thoughts in the beginning. It still is hard.
Of course.
And
it might be hard forever.
I think so.
That's what makes you a warrior. What do you do to take care of yourself when you're burning out, when life becomes unmanageable? Are you able to self-talk and stop and do something for yourself, or do you push through it?
I feel like I push through it more times than I should.
Okay.
I'm learning I'm not good at asking for help, and I'm not good at telling people if I need something, because I'm just I'll do it myself kind of person. I'll fix it, right? It's in the beginning, I want to fix things. So I've learned, instead of saying things like, hey, can I take a shower? I say, hey, I'm going to take a shower now. You can watch Gianna.
Yeah.
And I found that shift has helped. And then I love fitness. It is like, I love to run. I love to lift weights. I love to cycle. And so I'd often say, like, gosh, those 30 minutes of me on the bike, I could be with Gianna. I guilt trip myself about everything, every possible decision.
My God, the plight of the woman.
Oh, and so I finally had to say, like, you know what? I will be a better mom and a wife if I go hide in the garage for 30 minutes, ride my Peloton, scream and sweat, because I come back and I'm happy.
I'm shook, only because it's like, I think already everybody listening is having major feelings of inadequacy.
No.
You're 38, you're like 5 subspecialties, you're a mom, you're a wife, and then as your wind down, you're getting on the Peloton. I feel like I want to just give you a massive middle finger and be like, get out of here.
I actually convinced my chief that for physician wellness, they should put a Peloton in my office.
Because oh my God, I want a bed.
She listened to me.
Stop it.
No, I swear. So in between cases, I hop on the Peloton. So I literally...
You're a cyborg.
So you get like 30 to 60 minutes to chart, and then they clean the room and move patients. So as soon as I finish the case, I put my orders in, I call the family, and I run upstairs and I get on the bike. And then I'm drenched in sweat, and my partner just rolls his eyes at me because he's like, go take a nap.
It's like I'm sitting here like judging, and then I'm thinking, how could you judge how somebody else wants to unwind? If that's how you unwind, like, power to take the freaking do the Peloton class.
I know.
I can't understand it. I understand you the least, but I respect it, and I'm glad you're doing that for yourself.
Yeah, I mean, it makes me happier. It makes me a better person, friend. I just feel like I can't tell you to be healthy and eat well and take care of yourself, and then I do none of those things for me. I always say it's like the cardiac surgeon that's like smoking a cigarette outside, telling patients like smoking kills. And you're like, but you're smoking, so I can't tell you to be healthy and do these things. So that's kind of where I live. And for whatever reason, blessed or cursed, I've never slept. And I always say to people, like, you can't have everything. You can probably have 80% of what you want, but something has to sacrifice. And for me, unfortunately, it's sleep.
Yeah.
I don't get much of it, but
How many hours a night would you say you sleep?
maybe 4.5, maybe 5. Yeah, if depending on Gianna. Yeah, so that's probably what I'm averaging these days.
You don't look tired.
This makeup's really good. Although I still don't really know how to put it on, but
I mean,
working on it.
God bless you. I guess so. I don't know if you have anything to add, but my final question two things. My final question is how do you stay grounded in an ever changing and uncertain world? We might have got that answer with Peloton, but before that, anything that you want, any message you want to say to women about like something they could do for preventative, just something that you wish as a doctor you could tell every woman?
Yes.
Okay.
So don't skip your pap smears.
Okay.
If you see something that does not belong on your vagina or your vulva, say something.
Okay, well, so bumps,
Yeah.
lumps.
Bumps, lumps, new discolorations.
Okay.
Demand a biopsy. They hurt, they suck, but that's the only way you're going to know.
Okay.
If your periods are irregular, talk to someone and get it figured out.
Okay.
If you have a strong family history of breast or ovarian cancer, see if you have any genetic component to it. Ask for genetic testing.
Okay.
And just don't be ashamed to talk about your vagina. I hate to be my closing words, but literally your female parts, don't be nervous because there may be a true reason you're going through what you're going through and you just haven't asked. And if I could help save a life from that, get vaccinated, please.
For HPV.
For HPV.
Yeah. Vaccination's another topic.
Yeah.
For another. Okay.
Yeah.
I mean, that's really helpful.
Yeah.
Thank you so much for doing this today. I think I could speak for myself. You're so impressive. Your work is so impressive. I think you're just, anyone who chooses to do what you do and sacrifice so much is an angel on earth. So and thank you for giving me your time today and my audience.
Yeah, I hope your audience loved this. I love talking about women's health. So happy to do it anytime. Thank you for having me and for your kind words. I so appreciate it.
My pleasure.